When performing a hand series, there are three common projections performed: the PA, the oblique, and the fan lateral. For this, you'll want to sit the patient comfortably at the end of the table. The first in the series is the PA hand. Start this by resting their forearm parallel to the IR. You'll want to center the third metacarpal phalangeal joint to the center of the IR. Then, place the central ray to enter through the third metacarpal phalangeal joint. Collimate appropriately to the hand. You may have approximately a 1 inch to ½ inch border all the way around the entire hand, including 1 inch of the proximal ulnar styloid. Be sure to place your marker appropriately on the lateral side of the hand. Next, for the oblique, rotate the hand up so it's 45 degrees from the IR. Continue to use the central ray entrance point of the third metacarpal phalangeal joint. Next, you can perform the fan lateral by continuing to rotate the hand up so the metacarpals are perpendicular to the IR. This time, your central ray should enter through the second metacarpal phalangeal joint. Continue to use appropriate collimation. You have now performed a 3-view hand series. When performing a 3-view wrist series, you will notice that the part position is very similar to that of the PA, the oblique, and the lateral hand. For this series, you will start off with a PA wrist. Center the midcarpal region to the center of the IR. Place the palmar surface down and slightly flex the fingers. This will bring the carpal bones a little closer to the IR. Center the central ray to the midcarpal region. For the oblique projection, rotate the wrist up approximately 45 degrees from the plane of the IR. Continue to center your central ray to the midcarpal region. For the lateral wrist, continue to rotate the hand until the palmar surface is perpendicular to the IR. Center the central ray to the midcarpal region. You have now successfully performed a wrist series. The two common projections used when performing a forearm series is the AP and the lateral. The AP is preferred over a PA method to reduce superimposition of the radius and the ulna. When performing the AP position, place the patient's arm so it's fully extended on the IR. Be sure that the epicondyles are parallel to the IR. Center the central ray to the midpoint of the forearm. When collimating, be sure to include both the proximal and distal joints. You may wish to extend the light field 1 inch to 1½ inches beyond each joint. When performing the lateral, make sure that the forearm and the humerus are parallel to the level of the IR. This may require depression of the shoulder, lowering of the stool, or elevating of the table. Be sure to flex the elbow at 90 degrees and rotate the hand so the thumb is facing up. Once again, collimation remains the same, and central ray should enter the midpoint of the forearm.